And so I think things are really progressing quickly in the world of peptides for weight loss, but kind of a classic peptide that's been around for over a decade. It's withstood the test of time. It actually is, very safe, incredibly effective. We ask you to read the book, The Atomic Habits by James Clear. And then phase 2 is we say, hey, read the Essentialism by Greg McKeown, both great books. And then in phase 3 is Be Your Future Self Now by Ben Hardy. If you read those 3 books, you'll start to see how the habits and lifestyles are coupled with very specific peptides. In that first 60 days in your program, we have you on phase 1 and phase 2 of CellCore. And what phase 1 and phase 2 are doing is they're detoxifying your liver so that all the peptides, specifically some of these growth hormone releasing peptides, are metabolized better, and so you get better activity out of those.
All right. Good morning and welcome everybody to the Unreasonable Health Podcast. This is your host today, Cade Archibald, and we are excited to be back here. We took a short break for 4th of July and some holidays, and we're excited to have everybody back here. We got some people live, as well as you listening to the recording of this. Along with me, we have Regan Archibald. Regan, how's it going today?
Awesome. Yeah, couldn't be better. It's going great.
Very cool. Well, last night, the last session, we went through some of my favorite peptides and Reagan's favorite peptides on the Health Accelerator challenges. And the challenge that we issued last week is asking a really important question that you should ask yourselves right now, and we'd like you to submit your question or your response. But what would you like to tell yourself 10 years ago about your health, or what advice would you give yourself on about your health? So some things you can do. Email those in, send them into cade@accueastwest.com or info@accueastwest.com, and you can share some of your insights and everything. That is the challenge for last week, as well as Regan, we got to go through the peptide of the week. It's been a few weeks, so we need to get people charged up with the peptide of the week, where you're just accelerate. You got one.
Let's do it, because I am ready, and I'll share my screen. So for those of you who are watching on YouTube, or for those of you who love visuals, the peptide of the week is AOD 9604. And this one, it gets overshadowed with like semaglutide, tirzepatide, and all the GLP-1s. And there's a new, GLP-1 coming out that's got 3 peptides in it, because tirzepatide has 2. And so I think things are really progressing quickly in the world of peptides for weight loss. But kind of a classic peptide that's been around for over a decade. It's withstood the test of time. It actually is, very safe, incredibly effective. But and it's got, as do most really phenomenal peptides, it's got, this pleiotropic impact. And AOD 9604, AOD is, it's an anti-obesity drug, is what it was first studied as. They looked at it in the literature. They found that this particular peptide works on the growth hormone pathway, but it reduces body fat. One of the benefits is it triggers the release of fat from obese fat cells, more so than the lean ones. It mimics the way natural growth hormone regulates fat metabolism. So if you think about how you metabolize fat when you're younger, this peptide helps turn that pathway back on. It doesn't have an impact on, massive blood sugar drops. It doesn't impact overall growth hormone in the long run, or IGF-1 levels don't get elevated when you use this. It also stimulates lipolysis. And lipolysis is the breakdown of fat. And it's actually harder to burn fat than people realize. It's, because it's a structural tissue. And so as your body's going into breaking down fat, there's some connective tissue that gets lost in that process. And so AOD 9604, because it's working on the growth hormone pathway, and that's how it's breaking down fats, it's an easier transformation versus, like you see people who've taken high doses of like semaglutide or tirzepatide, or, which go by the drug names Ozempic or Mounjaro or Wegovy. The doses are so high and they're not combining other peptides with it. And so they have kind of a gaunt look, and you can start looking almost older as you're losing weight. But AOD 9604, if you stack this in with those GLP-1s, it's a really favorable way to lose weight, because not only do you stay more youthful, but you also have this beautiful ability to keep that connective tissue intact and not lose muscle mass, which is one of the big side effects of some of these GLP-1s. And then the other thing it does is it inhibits lipogenesis. So that means you're not going to be storing fat because your body's going to be utilizing it as energy. And then the other thing about AOD that's really impressive is that it's very favorable for cartilage repair. And so you can actually drop AOD into a joint that's been damaged, especially if you've had any kind of stem cell rejuvenation therapies. You can also use BPC 157. AOD 9604 can be combined with hyaluronic acid. You can drop those into the knee or to the hips, and it does have very favorable outcomes. So that's the peptide of the day, AOD 9604. Beautiful thing about this, you can use it topically as well as a subcutaneous injection.
Awesome. Love it. Well, thank you for that, Regan. So peptide of the day, AOD 9604. Try it out today.
Yeah.
All right, so let's jump into the content today. I know we have we're gonna dive into some intriguing stuff. What do we got today, Regan?
So today we're gonna keep on the growth hormone pathway. Because I think AOD is, if you look at this, it's one of the peptides that, specifically has been studied for, weight loss. And, the research shows it's been incredibly effective, very selective for the obese, the fat cells versus the lean cells. And it was actually studied as early as 1990. But if you go in and you say, well, what's the purpose of growth hormone? And growth hormone is one of the most important hormones in the body. Without it, our bodies would fall apart. I mean, literally. So if you think about some of the mechanisms behind this, growth hormone is considered one of the main fat burning hormones. And if you look at our Accelerate Wellness programs, during the reset, the recharge, and the restore phase, we're always working on the growth hormone pathways. For most of our clients, we're not working on that month one because we've got to reset the HPA axis. But what we're doing is we're bringing it in month two. And so this is where you'll frequently see like tesamorelin with ipamorelin. You'll see CJC 1295, MK 677. These are all phenomenal peptides that have very favorable impacts on the growth hormone pathways. And so with the growth hormone access, there's some of the things that it stimulates. Well, number one is it helps clean up the genetics in the body if you've got good, healthy growth hormone. Because as we age, our growth hormone population declines, and we'll explain that in greater detail in just a moment here. But the other thing that helps improve growth hormone is exercise. And Cade, any idea what exercises might improve growth hormone the most?
Let me think here. So more than likely you got your like super, I know super slow is really effective for growth hormone, weightlifting, like HIIT workouts.
Yeah, there you go. So HIIT workouts seem to improve it. Like when you're working on power and fast switch muscle fibers, that's where you can get the most growth hormone, almost 400 times more than other exercises. But then to your point on the super slow, if you're working on bigger muscles in the body, working on the quads, the glutes, working on the big muscles in the back, the chest, those complex movements, like the hinging, like with deadlifts or swings, the bench press, the pull downs, like pull ups or lat pull downs, squats, you're going to get massive increase in these hormones. And so this is one of the great things is when you start the program with us, that first 60 days, we're asking you to do 6 core essentials. We ask you to read the book, The Atomic Habits by James Clear. And then phase 2 is we say, hey, read the Essentialism by Greg McKeown, both great books. And then in phase 3 is Be Your Future Self Now by Ben Hardy. If you read those 3 books, you'll start to see how the habits and lifestyles are coupled with very specific peptides, because if you can use your own body and your own behavior, your own lifestyle to activate the peptide pathways, you're going to get a very high rate of return on those peptides, much greater so than if you just let the peptides do all the work. And I think that's where a lot of problems happen with peptides or any kind of natural medicine or any kind of drug, is people want the drug or the natural medicine or the peptide to do all the work, and they're not willing to change. So it's no different than AOD or any of these growth hormones or secretagogues, is they will speed up your progress if you're willing to put in the work. And so exercise is one of the great ways that you can increase this. And so you're going to have an increase in ghrelin, and ghrelin's a hormone that makes you hungry. So that's one of the reasons why we use ipamorelin in all of the growth hormone secretagogues. You'll see ipamorelin with tesamorelin or ipamorelin with CJC1295. And that's because it turns off that ghrelin response. It actually works on the ghrelin pathway so that that part of your brain is satisfied. Otherwise, you can get really hungry. One of the early peptides is sermorelin, which is phenomenal. Sermorelin, you want to take that before you go to bed so that you're not hungry, but you may wake up pretty darn hungry. Peptides that stimulate the growth hormone pathways also improve your amino acid profiles. So your body's going to go into greater proteostasis, and that's one of the 9 known causes of aging is loss of proteostasis. And so what the growth hormone does, if you have healthy levels, is it improves this protein synthesis. Growth hormone, specifically IGF-1, it helps stabilize blood sugar. It also can lower fatty acids. There's an interesting study in the use of tesamorelin for high levels of LDL cholesterol. And what they found in the participants in the study is they actually had a lowering of LDL cholesterol, which the LDL cholesterol can cause a lot of oxidative stress in the body. And then tesamorelin also has been shown to be effective if you've got like fatty liver disease. In some of the research that they did, and it goes by the name of Grifta, but they found that the participants who used tesamorelin, not only did they have a decrease in fatty liver disease, but patients with livers that were up to 90% fibrotic, it was able to reduce it down to 10%. And that was over the course of about two years.
Wow, very cool. So, Regan, we haven't talked a lot about sermorelin in the past. I know it's kind of an older peptide. It's been around for quite a while, but it seems like it's been there's been some popularities. I've seen a lot of different places talking about that. What's the I know you mentioned it really briefly. I didn't catch it exactly, but what's the difference between ipamorelin and sermorelin?
Well, ipamorelin, they're going to be different peptide structures. And so, the thing about ipamorelin is it's working more on the the ghrelin pathway and ghrelin is part of the way that you stimulate growth hormone. So there's two sides of the pituitary that it stimulates. So ipamorelin stimulating the ghrelin side, and then sermorelin would be stimulating the GHRH side, or it's a growth hormone secretagogue. And so it's like more of a growth hormone releasing peptide. And so helps with metabolism, body composition, metabolism is improved. Typically, sermorelin can even be used in kids that have, growth hormone deficiencies. It seems to be a safer route. But yeah, it's powerful. But the big difference is, when you use those together, like ipamorelin, you'll get about a 7 times greater spike of growth hormone. And the difference in using peptides versus growth hormone, exogenous growth hormone, is the peptides you're going to get about a 30-minute spike. And so if you're doing it away from food, so you want to make sure in any of these peptides, you want to do it in a fasted state, but you'll see a nice pulse of up to 7 times greater with the ipamorelin.
All right. So ipamorelin's got a little more strength. That's what you're saying.
No, it just works on a different.
Oh, you're just saying in combination with that.
In combination, and then ipamorelin will keep you from getting hungry because it's working on the ghrelin pathway.
Okay, got it. And then sermorelin, you're gonna that's where that growth hormone monster of hunger comes in. It's like, I want to eat everything in sight.
Yeah, you remember, some days you're like this still, but as a kid, like you just want to eat everything, and that is, part of it. If your blood sugar is balanced, part of it is that ghrelin, and that's when your stomach starts to growl, is when you have ghrelin response. We're like, time to eat. On the other side, the thing that, this does is, this whole growth hormone axis is it triggers glucose that's released from the liver. So you get better energy sources to the muscle. Insulin, like growth factor 1 or IGF-1, that's essentially the workhorse for growth hormone. And that induces cell division, protein synthesis. It also can help with bone strength. And so if you have, or concerned with osteopenia, osteoporosis, these growth hormone secretagogues can be very exciting and helpful. Actually, there's some research that was done with CJC 1295, and they found that the participants who had osteopenia or osteoporosis actually had a reversal in their loss of bone mineral density through, using a DEXA scan diagnostic tool. And so they're able to see like a 6 or 7% improvement in bone mineral density with the growth hormone secretagogues.
That's fantastic. That's amazing.
And then you can also use sarcotropin IPA. And this is one that's not talked about, but, the big danger of getting old is our bodies go through this, this stage called sarcopenia, where our muscle mass starts getting replaced by fat. And sarcotropin IPA seems to be a really powerful peptide and for sarcopenia, specifically. But it's indicated for 3 things clinically. One is to stimulate the release of growth hormone from the pituitary, because sarcotropin has GHRP2 and GHRP6 and ipamorelin. So, and pramorelin. And so it's got like this whole complex of growth hormone peptides. But then it also has like DMAO, it's got vitamin K2, vitamin D3, and then it's got leucine, L-arginine, L-citrulline, all these peptides to help improve vascularity and movement, vasodilation. But it also helps with nitric oxide production, and all of that combined, with the amino acids, with the nootropics, helps with the brain. And then with the growth hormone release, it's got about 100 times the volume of growth hormone than what you would get when you inject yourself, because it's an oral base. but it's a favorite of our clients and something that is easy to take because there's no injection required. So it's one of the few peptides that are oral based that also help on growth hormone.
Yeah, it's a great one. Has a nice pruny taste.
Yeah, pruny's a good, and it actually does. It has a little bit of prune juice in it, and that works on the ghrelin pathway, so you're not crazy hungry when you take it.
Perfect.
Yeah, you nailed it. So if you look at IGF-1 and you say, okay, well, what's doing the work for growth hormone? Well, if it's IGF-1 or insulin-like growth factor 1, so if you think of the hormone that causes the most volume of muscle and one of the most important hormones in the body for energy storage, it's insulin. And so if you have this insulin growth factor 1 or insulin-like, it's not insulin itself, but this IGF-1 is a peptide in your body that does a lot of work on multiple systems. And so IGF-1 is a peptide you can take independently. You can just take IGF-1 and it's really powerful peptide. If you push IGF-1 too hard, then that's where you can, as far as like, if you think of mitophagy and autophagy, sometimes if you're pushing IGF-1 too hard, you're in a growth stage only, and there's not enough autophagy or the removal of old cells. And so that can, long-term, it can, be problematic for like inflammation, heart disease, cancer, things like that, if you're pushing that growth pathway too hard. So this is where anytime you're using these peptides, like I mentioned in the beginning, is they need to be coupled with lifestyle changes. So diet, exercise. So this is where it's good to do some intermittent fasting, time restricted eating primarily. Really good to get exercise in every day. I find that is even more important now for IGF-1 to really kick in. But some of the benefits of IGF-1, if you look at it, it's 90% of IGF-1 is being processed in your liver, and this is where the liver health is so critical. And in your overall reset in that first 60 days in your program, we have you on phase 1 and phase 2 of CellCore. And what phase 1 and phase 2 are doing is they're detoxifying your liver so that all the peptides, specifically some of these growth hormone releasing peptides, are metabolized better. And so you get better activity out of those, because when your IGF-1 is working great, that metabolic center in your hypothalamus and your pituitary hypothalamus is like the executive of all the hormones in the body. The pituitary is the managerial team that executes on what's needed to be done. And this is where IGF-1 can really activate that. If you look at it from a thyroid perspective, when you have adequate levels of IGF-1, then your metabolism is going to go up. So your T3 will be more adequately expressed. And then T4 is that larger, there's 4 parts of iodine on this. T4 is called thyroxine. And you've got to strip off one of the pieces of iodine so you get the active version of the thyroid hormone called T3. And that all happens, primarily about 60 to 70% of it happens in your liver. But that process of converting T4 into T3 and also the increase of T3 is from the IGF-1. So if you've had trouble losing weight and you're like, man, this is a problem, my body is stuck. We've seen massive changes as we've gotten our clients from, the first 30 days, getting them sleeping better, changing that stress response in the nervous system, activating your vagal tone through the 3 Gs, the gagging, gasping, and gripping. And then when that second round of peptide shows up and you start working on these pathways, that's when you start to see the weight start melting and start turning off, and you see your energy levels go really high. But you're doing it in a way that's healthy for your body versus just suppressing all the symptoms or ramping things up with some type of stimulant. And so IGF-1, it also works on the macrophages and cytokines. So it actually helps create more intelligence in your immune system. IGF-1 helps with heart muscle and development. So our clients who've had issues with, cardiovascular disease, even cardiac arrest or any ischemic tissue, IGF-1 can be a great way of reversing that. The other thing IGF-1 does is it changes the white adipose tissue into brown adipose tissue. And so, Kate, do you remember the difference between brown and white adipose tissue and why it's important to get rid of that white adipose tissue?
And so your white fat is that the stuff that accumulates around the organs, or that's just like your toxic fat? I can't remember exactly.
It's sorry, I'm trying to keep you in the conversation and but it's where you get the mitochondria that get, they come from the surface of the cell or from the center of the cell out to the surface. And that's where white fat is not metabolically active. It's lazy fat. And so brown fat is where your body can actually use as an energy source because the mitochondria are awake.
Got it. So your white fat is just kind of sitting there, and that's where you're going to get really excess fat, and it's got to get converted into brown fat so you can actually burn it off.
That's it. Yep. And so then, once you can burn it off, then you have that dual motor that we call it metabolic flexibility, where your body can use either fat as an energy source or glucose. And I've never met somebody who doesn't want the ability to access that energy storage. I mean, it's kind of like, you got a passcode that you've got to put in. But once you learn the passcode and you can start accessing fat, it's a whole nother level of energy and stable energy.
Yeah, for sure. Yeah, it's a lot. It feels really good when you're running off of fat fuel.
Yeah, none of us want to carry around a whole big battery pack of all this fat unless we can utilize it at some stage. So that's the beautiful thing about using, some growth hormone releasing peptides, that work through the IGF-1 pathway. The other thing with IGF-1 is it does create more insulin sensitivity. So we see a lot of blood sugar regulation on this, less sugar cravings. We see some of our diabetic patients actually reverse their diabetes, which is pretty exciting when they get their lifestyle dialed in, because, it's what the CDC says is 75% of all chronic diseases are lifestyle based. So they are reversible diseases, and type 2 diabetes is no different. It's lifestyle choices. Modern medicine, specifically conventional medicine, is geared towards, let's diagnose a disease and then manage that disease. Whereas, what we do at East West and in our Accelerated Wellness program, it's all about reversing these diseases by getting your body healthy enough to do it. And so when you stabilize insulin and create more insulin sensitivity is what it's called, then that's where you're going to see your beta cells in your pancreas be much more healthy. And then one of the 9 known causes of aging is loss of nutrient sensing. And these beta cells in your pancreas and the insulin is very keen on learning where your body needs nutrients. And so if it doesn't know where it needs nutrients, then that's one of the reasons why we store fat, is because your loss of nutrient sensing, which decreases as we age, that starts to dwindle. And this is one reason why we do the reset with these growth hormone releasing peptides. It's phenomenal. And then the final thing that IGF-1 does is it helps both men and women benefit, on the sexual reproductive organs. But one of the things that happens in the ovaries is the granulosa cells. They increase their differentiation and proliferation, and it can help with pregnancy. And we just had one of our clients who told us recently she was pregnant after 3 months. And that's really exciting because her first baby required IVF therapy. And that was after, years of trying natural therapies. And then once she started working with us, now she's pregnant. And so this is one of the pathways we worked on. And it was something that was unexpected on them, but we expect to see that once we get the body healthy. The body can certainly conceive, and so IGF-1 is one of the peptides that we used, or actually it was CJC 1295 with ipamorelin, which IGF-1 is the workhorse for it. So that is, if you think about this, just to summarize, if you have healthy levels of growth hormone, yes, you want to turn it on and turn it off. And so, there's two paths to this, mTOR. You don't want mTOR to be on all the time. But this is where we use other peptides to activate AMPK and use, so you'll see multiple things stacked in your protocol to optimize your body's health. But once you get this active, then no reason why your body can't get younger and younger, no matter what decade of life you're in. So, Cade, what were your takeaways from today's conversation?
I think the growth hormone secretagogue peptides, or those growth hormone peptides, are so cool, and there's just really dynamic. I think really intriguing. Didn't quite understand how ipamorelin worked on the ghrelin pathway, and that's where it can help with that hunger surge. When you get growth hormone activated, it's you're like ready to eat, and so that's a really nice added benefit where it kind of helps ease that big hunger monster that may come around. So I thought that was really good takeaway and insight. Awesome.
Well, we appreciate you guys, and thanks everyone who came to the retreat last night, or yesterday, I guess it was. We all went to dinner last night, so it felt like last night, and went up to Snowbird, and it was great. But had an awesome retreat. Our next one coming up is July 27th. I know that one is getting close to filled up, but if you have not attended an East-West retreat, make sure you sign up for it. You've got to get your blood work ran prior to it. But holy cow, they are a blast. Everybody who was there couldn't believe how quick the day went, but also couldn't believe how much better they felt, because our promise is we'll do more for your health in a day than what most people do in a year. And we've been true to the promise in the dozen or so retreats that we've held this year.
Yeah, these retreats are amazing. So if you haven't been to one, or if it's been a while, reach out to us, give us a call, 801-582-2011, and you can sign up right there. You can also go to acueastwest.com/retreats. And that's going to give you the ability to request that as well. So yeah, we'd love to host you. If you're listening to this recording, jump on that. So looking forward to that, and we'll see everybody next time.
Yeah, and you can learn more about it at acueastwest.com, and then make sure to share this episode with people that you love, and we'll talk next week.
See everybody.